So good afternoon, friends. It is good to have a large group gathered. You're not all from Wisconsin, but many of you are. We have friends from around the country who have come to us for our advice on COVID. We're really grateful to be a source for people from around the country for reliable information on how to do church safely and in ways that are pastoral and prudent. This is what we've billed as returning to church 2.0, but we know that church has still been going on in these days, that it has been a place where people can get what they need to make it through a time that has been traumatic and challenging and isolating and confusing. And we know that the church is resilient, that things can go on regardless of whatever challenges we face. They look a little bit different, but they keep going. So our plans will be made available through our website as a PDF, as I mentioned, but we have context for you. We have some answers about what these plans prioritize. We have critical approaches for when we believe it will be safer to return to ministry in physical place. And we also have answers to some questions about how we should go about doing this safely. We have a whole pile of resources for you, a couple of pages of links at the back of this document. And as I mentioned, we're going to try and share all of that with you and leave time for questions within about an hour or so. So let's get started. We've titled this document Holding Our Plans Loosely, with the realization that COVID has made things unpredictable. And so let's talk a little bit about the context we're doing ministry in. We have lived in this past year through multiple social and political crises. If you're not coping with Zoom fatigue, you are a very unusual person at this point in time. We are concerned about our own mental and emotional health, the mental and emotional health of the people that we are shepherding, and the society at large. Many of us are concerned about the fiscal health of our churches, especially as the pandemic goes on. We've heard from many pastors, especially in the survey we did last summer, about the pressure from parishioners to reopen. We often look at neighboring churches that might not be following the same guidance and what they're doing, and we express our concern about, oh, well, our neighbors are open. Should we open? We have our own internal pressures and urgency about what we should be doing. On the science side, we are dealing with a continuing pandemic. The science keeps evolving. Now vaccines are available to us. We're hearing about new COVID variants and what factor they might have in all of this. And we know that all along, COVID has been politicized. And we think it's really important to name all of those things as we put together a plan. We think that's really critical to know what we're working through. The recommendations that we're releasing today have certain priorities baked into them. Very first is the life and the health of the neighbor. In addition to that, we reflect a lot on creativity in ministry, leaning into holy experiments. We think about urgency and care in meeting human needs. We urge you to pay attention to diversity and accessibility. Paying attention to these things is actually a manifestation of how we can be one church whether we're dispersed or together in one place. Even when we're doing hybrid ministries, this is a manifestation of being connected and reflecting the unity of the church. We want you to pay attention to the church's role as a community leader. And we also encourage you to trust in the resilience of the church. I'm going to say that again. Trust in the resilience of the church. We've been living through trauma. We're anxious. We have a sense of urgency within us. We need to trust that God will bring us through. The theological and ethical grounding in this document talks about the fruit of the Spirit. You know these. You may have sung them in Sunday school. You may have learned them by heart at a very early age. Love, joy, peace, patience, kindness, generosity, faithfulness, gentleness, and self-control. We know when we make decisions that are faithful, that are spirit-driven, we will see these fruit. And so as we ask these critical questions about when we can return, how we'll return, who we can trust, how we're going to manage things until then, and then what happens after we return, we need to watch for these fruits of the Spirit to know that we're on the right path. So let's get to why you're all here. Everybody wants to get back to ministry in physical place faster. It's the question we get all the time. When is the day? How do we make it get here faster? The best things we can do to make the day of return come faster. 1, encourage vaccination, enthusiastically even. Yours, your staff's, your parishioners, the community at large. And 2, maintain the expectation of individual and community COVID protections. This needs to be a norm until most of us are vaccinated and until viral transmission in the community goes down substantially. Until that happens, it's not going to be very safe to gather in large groups doing the things that we do as churches that we've talked about for the past year are very good at transmitting virus. Knowing these things, having these things in the background, we're recommending a 2-step approach. We have had so much data that we've been tracking. People have been looking at all sorts of websites and trying to figure out, oh, is it this rate or that rate, and the 7-day or the 14-day or today's or what have you. We're going to ask you to track data in 2 steps if you're following our recommendations. First, watch the vaccination rates. That's it. That's the only thing you need to track first. Watch and wait until vaccination rates get to 50 to 75% of the population. Until we get there, the rate of COVID in the community is not going to get low enough that it'll be particularly safe to gather in physical place as a church. Once we get there, according to our medical advisors, we'll start seeing the background rate of COVID in the community decline. At that point, we can actually start looking at some of those COVID numbers again, see the numbers coming down, and start getting excited. The 2 numbers we're recommending you look at that point are COVID cases per 100,000 population and the rate of positive COVID tests. That's it, 2 numbers. We track them on a statewide basis. They are readily available on a countywide basis. We'll be posting these on a statewide basis on our website at least twice a month for you to keep track of. Now, then the question is, okay, so when is it going to be safe? How do we know? That's great, Carrie. Track the numbers. When are the numbers the right numbers? So let's take a look at that. We've set up these rubrics to let you know when we've been advised it's unsafe categorically, when it might be safer, and when it's safest to gather. The safest is our gold standard. And that's what we recommend as the best choice. If for some reason you don't believe your church can wait until that point, you can look at that middle tier as a possibility. So our medical advisors are telling us that when vaccination rates are less than 50% of the population, it's not time to gather yet. Once we get to 50 to 70%, we're going to start seeing the viral transmission come down enough, most likely, that things will be in play. When vaccination rates get to 70 to 85%, then we'll be in much better shape. Viral transmission, when it's over 10 cases per 100,000 people, and we have more than 10% of tests coming back positive, it's not safe to gather, what our medical advisors have been telling us. On the other hand, when we get to maybe 5 to 10 cases per 100,000 people and positive tests less than 10%, we're in the ballpark. The safest choice is less than 1 case per 100,000 people and less than 5% of tests coming back positive. Now, I want to give you some context for this. I went and pulled the data this morning, state of Wisconsin. I told you the first number to look at is vaccination rates. As of this morning, 26,708 people in Wisconsin had completed their vaccination series. That's out of 5.8 million people. It's about 0.5%. We need to get to 50% of the population. Viral transmission. We need to have at least less than 10 per 100,000. We have 59 people per 100,000. Positive tests, we need to have at least less than 10%. We have 28% of tests coming back positive as of today. So you can see we're well in the unsafe category. It's going to take a long time for us to get into the safer category. Never mind the safest category. I'm sure there are going to be a lot of questions on that, but I wanted to point out to you, there are sites where you can get solid data and reliable data. And these are some of the sites that we recommend to churches when they ask us. We'll post on our website. Our go-tos are the DHS Wisconsin website and globalepidemics.org. That's run by Harvard Global Health and several other global health organizations from universities. And we highly recommend those. The CDC is also great. And the New York Times website also has great data. We're very comfortable with all of those. I say whatever site you choose it and stick with it, because they all have minor variations depending on reporting dates and things like that. So choose one, stick with it. All of these are reliable sources. There is a DHS link that shows vaccination rates. If you go to that DHS data summary page, it'll have an additional link there. And we've also linked that in the appendix in our document. So there will be a ready link right there for you. So that's the when can we return? And the answer is it's going to be a while. Our medical advisor's best guess is late this year, or perhaps even later if we're slow as a population to get vaccinated. So that's a lot of variables. It could be early if we're very good at getting ourselves vaccinated, but most likely it's going to be late, possibly later. It's not the news we want to hear. We've had lots of ideas in our hearts about, oh, I want to get back for Easter. Wouldn't that be lovely? It's not going to happen this year. Easter really needs to be remote for safety's sake. And the reality is that it's highly likely that this fall is going to require many protections as well. The next set of recommendations we have is how to return. So when we get to the point of returning, how do we make that happen? So say it's this fall or early this winter. And again, we don't have the date. We can't tell you the day that it'll be safe, but we have these benchmarks for when it would be. When vaccination rates are well over 50% and viral transmission in the community is very low, expect a long time of precautions when you return. We'll still be masking and distancing and things like that. At that point in time, plan on the best mitigations you can agree upon as a community and using hybrid ministry options. There will still be people who will need to access the community remotely at that point in time. There will still be people who want to access the community physically at that point in time. So returning hybrid is one of our key recommendations. Here too, we have a safer and safest rubric. Number one, our advisors have said, don't do it all at once. That is one of the riskiest ways to do things. You don't go 0 to 60, right? That's the surest way to put people at risk. To make it safer when you come back, we should make face masks a requirement. And the suggestion is, budget for it, have some on hand, make it so the pastor's not responsible for ensuring that people wear face masks. Plan on physical distancing and a low touch environment. We talked about this a whole year ago, and we have a webinar on that. That was our first webinar we did. So you can go back and refresh yourself on that if you'd like. Plan on meeting outdoors or increase your air exchange in the building. You don't want to use fans, but open windows, open doors, modify your HVAC system to increase your air exchange. Shorten the time of worship. Those of you who've experimented with worship have probably tried some of these strategies. If you choose to sing at that point, you would want to have just your worship leaders doing it and a good distance away from people. Sanitizing, we don't need to go over the top. We've learned a lot about that, and a real focus on high touch surfaces would be important. So, light switches, tables, doors, things like that. And make sure you have some kind of attendance list so you know who is there if you have to track and notify people if anything happens. Our gold standard is all of those things, but absolutely minimize or cut out the singing altogether. We would recommend a hybrid plan with phases to it. to wait a month or more between phases because that's a couple of viral transmission periods. Have a fallback plan because we know what opens sometimes needs to close again if you have an outbreak. And be ready with a communication plan. We have some recommendations for that in our document. And make sure it's a team responsibility. So it's not just on the pastor and the staff, but that you really have something solid that you own as a community of faith. Here's where I have a word about vaccines. We see a lot of musing in online forums about what it means when we come back. If my whole staff is vaccinated, if my whole choir is vaccinated, can we do this? Can we sing, etc.? And what we have learned from our advisors is that vaccines are important and. So not just vaccines are important, but vaccines are important and they're not a free pass. Even the best ones aren't 100% effective. We're looking at 95, 90% effective. One of the reports that just came out recently on one of the new ones that might be hitting the market later this year. But 95% effective is still 1 out of every 20 people isn't protected. And we have to be aware of that. It's also not been tested on asymptomatic infections. And we know that not everyone will take the vaccine. So we still have to protect all of those people. So we've been advised keep up those precautions until we have a dramatic reduction in viral transmission in the community. So absolutely, vaccines are good, they help, they're important, they're going to get us where we need to be, but not immediately. We get lots of technical questions about singing and Eucharist and other activities. We have this whole list of the most risky activities that churches can undertake. And so we call those out here. Number one, singing. As much as we long to sing together, it's not time yet. It's going to be one of the last things to reintroduce. If you really are longing for that, we have virtual choirs, we have recordings available. The make it safer possibility is to mask, to distance 6 to 10 feet or more, to have singing outdoors and have it done by the leader only. So you might have a cantor or a very small group, but not the assembly, not a choir at this point in time. Our medical advisors are very, very leery of this. They say it's one of the last things for us to reintroduce. On the Eucharist, there's been a lot of study and science on that. And so I'm not going to go into detail on that, but think about your basic sanitation practices. The less you can handle it, the better. The less the people can handle it, the better. So can you pre-position it, pre-package it? Can you distance people? All those sorts of things. The more of that you can do, the safer people will be. The same thing with eating meals together. It's not time for a church supper yet. It's not going to be when we get back together. Plan alternative activities, plan on home delivery, pre-packaged meals, have something pre-assembled, have it to go, hand it out outdoors. Anything outdoors is better than indoors. And for heaven's sake, don't plan a buffet, not yet. So think about your funeral luncheons, your community meals, anything like that. All of these are alternative ways to handle them. Home and care facility visits are such an important thing and a big part of why pastors are asking us about vaccinations and when we can get back to these. We still say the safest way to do it is by telephone, video, front porch visit, even writing notes and cards. Um, but when they need to happen in person, plan on a mask and a face shield, sanitize your hands well. Um, Try to limit it to one person a day. You think about your risk budget. How much risk are you going to entertain so that way you don't carry virus to other people? And do simple things like changing your clothes after a visit, so you're not spending your time just immersed in this environment of virus. um, and of course, don't do this unmasked. It's number one thing. Don't Make sure you've got a mask. um, we have a whole bunch of frequently asked questions we get um, regarding how do we handle all of these technical and policy questions. Um, be clear and consistent, follow the standard a reasonable person would follow, and you're probably on the right track. So, what we've heard as we've consulted folks is don't panic about a liability waiver unless your insurance agent says you need one. Put a sign up and say, hey, there's COVID around. We're being prudent, but this is at your own risk. In terms of building use, we're in the business of ministry. When you open up your building for your own community, open it up for a wider community, but have groups undertake the same policies, limited use, things like that. Make them responsible for the space. Big question we get is on vaccination. Can I require my employees to be vaccinated? Should we require the congregation to be vaccinated to come back to church? And our position is educate, advocate, and encourage, but do not require. Um, Huge fans of vaccination here. But in the end, we don't believe in making it mandatory. And there are links in our document from the Society for Human Resources Management and the EEOC to give you a little bit of background on that. As an employer, be flexible. If there's a way to offer reasonable accommodations to employees who need to work from home to stay safe, or just in general because we want to keep our folks safe. Whatever you can do, you're going to help keep the community healthier for a longer period of time. And overall, when in doubt, ask the questions of your consulting experts. Talk to an attorney, an insurance agent, a adjudicatory leader, to make sure you get your guidance if you get into a thorny situation. Don't just wing it. There's a whole section of our document on making healthy decisions, and I just want to highlight a couple of them. Commit to a guiding authority. Again, pick something you're going to use and stick to it. It helps with predictability. It helps people know what to expect. And in such a chaotic time, that matters to people. So for example, if you're choosing to follow Wisconsin Council of Churches guidance, then okay, you can publicize to your church. We're listening to what the Wisconsin Council of Churches recommends, and we're following what they say is their safer level of recommendations. Okay. So then you've got a guiding authority and you've got a risk level. Or you may say, I have a risk budget. There are only so many risky ministries we can undertake, and we have a community meal in our church. And we realize that entails a lot of interpersonal interaction. So therefore, we're not going to expose our pastors and volunteers to a whole lot more interaction. So therefore, we're going to keep our church office closed much longer. That's the idea of a risk budget, if that makes sense. Pick a statistical source and stick with it. I talked about have a plan. I can't say this more. Have a plan, have a plan, have a plan. When something happens, it's hard to think. And the idea of having a sheet of paper you can take out of a file folder, or even that's been sitting underneath your computer in case of crisis, and you can pull it out and say, oh, yes, this is my script I'm going to use when I'm calling people to tell them they may have been exposed to COVID. It's a gift to have, and future you will thank you. Um, it's a time of great polarization. Uh, to be able to shift from the us versus them mindset to an all of us mindset is a gift. Um, and it's a particular gift of the church. You know, if you think about Jesus and the parables and how he had that parabolic mindset, and if somebody tries to pit us versus them, well, you know, let's tell a story about that. Let's find a way that's not either or. It's really important. The resources you'll receive after this, I mentioned, the PDF and the slides will be emailed. There's a recording that'll be available on our YouTube page. And the PDF includes the full text of recommendations. You will have 15 pages worth of what I just sketched out for you, links to statistical sites, helpful information resources, webinars, videos, and our coronavirus index. That being said, here are some ways to reach me. Our office telephone number, which is forwarded right now because we are working remotely because of COVID. And our office email, which I will be glad to use to address any particular questions that come up that might relate to your specific church. We do some COVID consulting, so if you have specific questions, we're glad to work with you on that. All that being said, I'm going to suspect there are a bunch of Q&As that have stacked up while I have been talking. And I'm going to call on my colleague, the Reverend Brianna Illinet, who has been patiently working in the background. She's our curator of content and ecumenical innovation, and ask her if she would lend her voice to point me to some of the most important questions we need to get to.
Yeah, so we have a couple folks who are wondering about our numbers. You cited the number of so many cases per 100K and wondering, is that like a daily number? Is that how many are ongoing, or what is that number?
Sure. So the numbers I cited that I pulled today was a 7-day rolling average. 100, so cases per 100,000 people on a 7-day rolling average. So that means, you know, every day it might go up and down a lot. A 7-day rolling average smooths out the bumps. So if that helps you a little bit.
And then there were a few questions about vaccination and how that works, especially because right now vaccines have not really been deemed safe for children. So are children included in that number, or how does that work?
Yeah, so the percentage I gave you was for the entire population of Wisconsin. I was in a webinar last week where we were talking with someone who is very well read on the topic of vaccines. And she was saying that there are vaccines in trials right now for children over the age of 2, I believe. What we have right now available was only tested on folks who were over the age of 16 or 18, depending on the vaccine. But there are now vaccines and trials for younger children. So once they get through that, then we'll have more vaccines available for younger folks. Same thing for folks who are pregnant. So we're going to get there. It's just the first ones they rolled out, kids weren't eligible for. In terms of getting your hands on the vaccine, Wisconsin pastors, If you are a volunteer chaplain, volunteer spiritual care provider in a hospital system, get in touch with the hospital system or with your local health department. You should be eligible to receive the vaccine now. If you are not a volunteer chaplain in a hospital or a medical system, some counties are including all pastors in their phase 1A, which is the top tier of get your vaccine now. Other counties are not. So it relates to this whole fragmented response to the vaccine at the moment. So unfortunately, I can't give you a blanket answer in the state of Wisconsin, except to tell you that we're actively advocating for clergy to be in phase 1B because of the risks to the community, the risks as a class, and the importance to community response and mental health.
I have a question wondering about kind of how we came up with this. Who are the medical advisors? Who are the people we talked to as we put together this document and these recommendations?
Absolutely. We've outlined that more in the document itself, but I want to shout out some of the most helpful people that we've spoken with. All throughout this pandemic, Dr. Joff Swain has been a rock for us. He was the founding director of Milwaukee's Office of Health Equity. He was on the faculty of Wisconsin's medical schools. He had a 26-year career in medicine and public health. And he came out of retirement as a volunteer for the Wisconsin Department of Health Services during COVID. Before that, he'd also worked on multiple epidemics. And he's just been endlessly available to us for questions and things like that. We've had regular contacts with the Department of Health Services, with folks who are trained in epidemiology and in lab technology. The webinar I mentioned last week was with, okay, this is a long one now, an immunocytochemist who also happens to be an executive presbyter. So she's got church and medicine on her plate. She's worked in the pharmaceutical industry as well, and she's got a wealth of experience. We're grateful to the Milwaukee Presbytery for making her available to the church. And we've also spoken with nonprofit employment attorney to vet all of these recommendations as well. Beyond those personal conversations, we also have websites and emails and consultations that we go to, but those are the most extensive ones that we work with.
So I have a question here about small congregations versus large congregations, saying sometimes people in smaller congregations think it's safer to return because they're so small and can maintain physical distancing. And so wondering about how to respond to that.
I think that's a mixed bag. The reality is in smaller congregations, sometimes we tend to act more like a family and let our guard down and get closer and closer to one another. And it can be harder to enforce guidelines with one another because we have these really close relationships with one another. And so that would be my caution, is to treat that pastorally and really explain that caution. The virus doesn't care that we're a small congregation or that we have a small building. The virus's mechanism just knows that there are human beings next to one another. It can jump from one to another.
So I have a couple questions on small groups, wanting to gather with 10 or less with distancing and masks, but then some of the people are also in these groups are also elderly. So how do you navigate that? How do you be empathetic in that? Um, and then also just what about small groups like scouts or AA, and if they follow, should they be allowed to meet?
I think that goes back to the mitigations, right? Once you reopen your building, I would let groups you use your building back into your building so long as they can abide by whatever guidelines you set for your church. So if our guideline is we will allow 10 people to gather at this point in time according to whatever phase we've created for ourselves, and there's more on that in the printed document. So again, I couldn't put everything on screen today. But if our guideline is right now we're going to let 10 people gather in our building, then you tell the scouts or you tell NA, we'll let 10 people gather right now, but you get this room and you're responsible for wiping down the tables and the light switches and the doorknobs when you leave. And you're responsible for keeping a list of who was there in case somebody was exposed or somebody tests positive. And in terms of the pastoral question of your own groups and high risk people, your people and you love your people and you want to keep them safe. How do you lovingly tell the 87-year-old that you don't want to risk their life to come to a Bible study, right? So how do you plan an event that mitigates the risk as best as possible when you're working with the high risk population? Can you do it outside? Can you have people bring their own lawn chairs? Can you keep the time short? All of those things.
So the next question kind of, I think, carries on with some of that. Of a couple of questions of folks who are wondering, what do we do when schools are in session and people are working at stores and going shopping and all these things are open, but the church has such a high bar and we're still closed. And so how do we be pastoral in that sense and explain why?
Right. Well, I think in that regard, we have a couple of ways we might go. One of them has to do with the type of activities we do in church and talking about how they're particularly risky. The things we do in church are tailor made to spread the virus. When we do all of the things we know and love as church, get together in close quarters and speak in unison and we sing together and shake hands and all of these things, we have been very good at sharing viruses with one another. And even though we're talking about mitigations, we know we're not going to have 100% compliance, right? We know that there are going to be people who push the bar. And we need to be really cautious that we don't put people at risk. So, our call as church is to protect life and health. And if what we do puts people at particular risk and we can do it another way, our obligation is to do that. Now, that's not necessarily the call of the sandwich shop down the street, right? Or the coffee shop down the street. Now, is it part of their business to not sicken their customers? Sure, but that might not be their best and highest call. And they don't even talk about their work in that way. We're the church. We operate according to a different standard. But I know it's hard. You see other churches, you see other businesses open. But we wait, and we do that out of love for the neighbor. In our document, we refer to Galatians 5, and we talk about the freedom of the cross. And we weren't set free for self indulgence, we were set free so we can transform something. We don't do that by doing what we want, we do that by doing what the world needs.
So we have another question on vaccines. This person had a church member ask, once people get vaccinated, can they come back to church if they've proved they've had the vaccine? And they say, this seems like not a great idea, but could you help articulate why? This would be helpful.
Okay, so the question is, let me say that back. So the question is, once they've been vaccinated, can they come back to church?
Yeah, or like and prove that they've been vaccinated.
I would say if your church has said it's open for physical ministry and somebody's been vaccinated, sure. If your church has said it's not open for physical ministry, then I don't think it matters whether or not somebody's been vaccinated. You've set a policy and that's your policy.
I think there's also the idea that we can't prove that even if you've had the vaccine, whether or not you can be an asymptomatic carrier, and you can, like, we're still figuring that out. And so even when people have the vaccines, we still need to wear masks and do social distancing and that sort of thing. So it's not, a vaccine's not a free pass.
Exactly. It's no guarantee that you're not spreading the virus asymptomatically. There are a whole bunch of cautions there. So even though you've been vaccinated, you still need to follow the guidelines that we've set as a community norm. And by we, I mean you, your faith community, not we, the council. We have no authority, we just have influence.
So we're still getting a lot of questions about small groups. And specifically one question is like, can you have multiple small groups in the building at the same time? Or like, how do you navigate that? And what do you do when you have small groups versus larger small groups?
Right. So in that case, I think that would be part of your phasing plan. And I realize I've been kind of sketchy on that. Let me see if I can pull up something that would help you on that. And this is going to come from our PDF, so it's not going to be as slick and elegant as our slides. Okay. Making it big enough to read also, because we know that can be a trick. Okay, this is straight from the PDF. So when I talk about a phasing plan, this is something like what I mean. You would want to create something specifically for your own church. So you might say, when COVID numbers are like this, we'll do that. So when vaccines are less than 70% of the population, we'll encourage vaccination and have the staff flex work. They'll work from home. When vaccinations are over 70% of the population and about 25 cases per 100,000, we'll let recording happen in the sanctuary again and double check our phasing plan, give the congregation an update. When we get down to 10 cases per 100,000, we'll reopen the office for visitors and start getting ready for in-person worship and have things in the parking lot and update the congregation again. And then when we get to 5 cases per 100,000, we'll organize limited attendance events. And then I have question mark size. That's where you decide what size you start with. And the idea is we start small and we see how it goes. and make sure you don't have an outbreak. You don't start big and shrink back down. You start small and make sure the numbers stay low and we don't have any unfortunate incidents. So that might be where you start with 10. 10 is a healthy number. And then say, okay, we're going to do this for a month to 6 weeks. And as long as things stay okay, then we'll go to 25. As long as things stay okay, maybe we'll creep that up to 30 or multiple groups, things like that. So when you talk about multiple groups in the building, you realize you're increasing the possibility of mixing because you have entryways and coat areas and restrooms and things like that. So I think you'd probably want to start with one organization in the building at a time. And then as you phase, you might want to say, okay, we'll let 2 organizations in the building at a time for, no more than 30 people or something like that. So you'd want to think through that carefully. But, always be aware of, the load in one room and the load in the entire facility, if that makes sense.
So here's a question is, could you address some tips for navigating politicization of the COVID and we just moved, and the de-escalating conversation regarding which sources and criteria used for planning to gather again? There was also another question about kind of the rural versus urban divide that's happening, and what does it mean when it's like the big city that's kind of driving this conversation?
Mm-hmm. I don't think it's just a rural versus urban. I mean, I think it plays out slightly differently in different areas, but I don't think it's only rural versus urban. It has been politicized. Like everything else in this country, it depends on which news sources you listen to and which communities you run in and all sorts of things like that. The question is, how do we learn to listen to one another and receive one another's words and reflections with Christian charity, right? How can we agree to trust one another, trust the decision making processes we use together? Um, One of the things conflict experts tell us is that most church fights happen not because of the decision you arrived at, but because there was a lack of consensus or agreement on the process you were using to arrive at the decision. And so, if you can very clearly work together on agreement for the process, that's a really important piece. And then if you can really carefully work to stay in relationship and not other the other party, not turn them into an it, that'll go a long way. It's not a panacea, but it helps. And those are some of the key strategies. We can also work to post on our COVID site. It's not built into this document, but some of the articles from UW faculty and other sources that we've seen on understanding different perspectives in the state of Wisconsin. We had a speaker a few annual meetings ago, Kathy Kramer. If you haven't read her work, that's very good. But really, it's leaning into our Christian values about treating one another with charity is so critically important. I'm aware we're coming to the hour. Because there are questions out there, I'm willing to give this a few more minutes in case there are things we need to get to, Brianna, that we haven't touched on.
I think one of the other questions I'm trying to catch things into themes. So if your question isn't being answered, maybe like like you can throw it in there again just to trying to navigate all these. But another one theme is kind of around this, the question of like, do we know how many churches are worshiping virtually in the state? But then what do you do when people say, why is our church worshiping virtually and all those other churches are in person? And
Mhm.
how do you navigate that?
You know, mom said if the other kids jumped off a bridge, would you too, right? That's a little flip. But realistically, every community needs to make these decisions for themselves. And ideally, would we consult? Yes. Ideally, would the church be of one mind and demonstrate our unity in Christ? Yes. However, we know that the church does not live out its oneness in Christ on a daily basis. We know we struggle so deeply with that one. We're human beings, and though the church is Christ's, we have created a human institution. Sometimes we just need to say, they're doing their thing, and I can't convince them to do something else. But as for me and my house, we're going to do what we understand to be faithful for us and the people we serve.
So I have a question about singing again, of just like, how do we know it's not safe? How do we like, there are some things that say that maybe it is safe. And what do we do when there's this conflicting advice given? And
Mm-hmm.
how do we know if it's a risk or not?
I think it goes to choosing a source and not constantly flipping back and forth, right? I mean, there's so many information sources out there, and you can make yourself sick um, trying to inhale all of the information. Choose reliable resources and lean on them to vet the fire hose of information, and trust that when something is found to be trustworthy, they will get it to you. So, for example, Dr. Michael Osterholm at CIDRAP, the Center for Infectious Disease Research and Policy, um, wonderful resources. Friendly Neighbor epidemiologist, um, wonderful resource. She's on Facebook. She's a church person and a faculty member at a university. Um, digest things all the time. These are science-based folks. You know, they're not just sharing, their random opinion, but they're sharing well-reasoned opinion that is influenced by years and years and years of experience in their fields. I mentioned earlier, don't go hopping around between websites looking for data. I think the same thing. Don't go hopping around between websites looking for the latest research, because you'll go bonkers. You'll give yourself a headache. So, yes, do I want to sing in church? My goodness, yes. So badly. I miss singing with the congregation I worship with. But I'm going to wait until the sources I have trusted tell me that it's a safer choice.
Um, so I have a question about staff. I know there's no easy answer, but what about staff that don't feel safe returning? Are there any legal protections in place, or are they just at will and too bad if they can't continue with us?
there is very little to be lost by being as flexible of an employer as you can. The question is, can you offer some kind of reasonable accommodation so they can do most of their job duties from another site? This is an extended crisis. How can we be creative in fulfilling our ministry? I think that is a question for all of us, not just out there to people, but in here in our business operations, in the day-to-day work that enables us to do what's out there.
So this is one about kind of how do we weigh what to do. There's a real concern for people's mental health in the communities where I serve due to isolation. How do we most faithfully balance a person's mental health, which benefits from community, and physical health, which right now benefits from distancing?
Mm-hmm. We've talked about that a lot. There are some great resources available in Wisconsin, including Project Recovery, which we had a webinar on earlier this year, that's committed to helping Wisconsinites address their emotional and mental health through this pandemic. I think the biggest thing we can do is working against isolation. Even if we're physically isolated from touch, from hugs and handshakes and things like that, there are a lot of things that we can do to ensure that people have an opportunity to see others and interact with others on a regular basis, and that we construct systems of care within our churches so we can look in on the people who don't have someone living with them, or who don't necessarily get along with their families, or for whom home isn't a safe place. Those are really important things to do. And just because we can't gather physically doesn't mean we should neglect those things. I spoke with a pastor who dropped a basket of food off for a parishioner, and it was an older woman who was very, very lonely, and just put out her arms for a hug. And the pastor said, I couldn't help it. I gave her a hug because she so desperately needed that. Now, I'm not telling you should do that every day. I'm not saying it's a wise and prudent choice health wise. But what pastor doesn't have a heart that would break in that moment? And you might do it. And then you might hightail it back to your car and sanitize your hands and go home and wash up and choose to isolate yourself for a couple of weeks because you had a potential exposure. But maybe that's what the Spirit was calling you to do. Again, I'm not recommending it. And it's not something you're going to do with all your elders. No good answers. Sometimes less bad answers.
So I think we've mostly touched on as best we could. I was trying to compile things together as best we could. I think a reminder is that our staff is available. If there's something that you asked and we didn't quite get the nuance and you want to talk it through, we are available. Carrie put her number, office number on the screen, and we have email to reach out to us. We can help you think through and say what we've heard and offer advice and be in consultation.
I'm so grateful for all of you being willing to learn and be prayerful about the work of ministry in this time. My prayers are with you. If there's one thing I want you to take with you, it's that you're not alone. Ministry can be lonely, especially right now, and you're not alone. Our staff and the religious leaders of Wisconsin are praying for you and holding on to your ministry. So go in peace, wash your hands and mask up, and someday we will be singing together and praying together in physical place. Godspeed.